Hey, what's up, guys? Dr. Jim Morgenstern coming at you here from Rubber City Chiropractic in beautiful Akron, Ohio. I hope everybody's doing well out there. We got another workout coming up this week from the CrossFit Open, workout 22.2. It should be a doozy. So we've got an ascending ladder of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then a descending ladder 9, 8, 7, 6, 5, 4, 3, 2, 1 of deadlifts at a weight of 225 pounds for men and a weight of 155 pounds for women. And that is back and forth with bar-facing burpees. So I came up with a little mobility prep for you guys. I hope you enjoy it. Give me some feedback, and let's follow along. All right, guys, so deadlifts and burpees ask a lot of our bodies, especially our lower back. So one of the first things that I like to do before we deadlift or go into like a hyperextension that burpees might actually put us in is I want to try to check in and see what's our hip flexors feel like side by side. There's a great product out there. It's a brutal one. It's called the So-Right. You guys know in person, I like to show you how to release your hip flexors with a sand ball. But for the sake of this video, I think the So-Right's a good one to begin with because we can get in there bilaterally and check in and kind of see where are we feeling those sticking points, okay? For me, usually my right side feels a little bit tighter than my left side, but if I even this out and kind of release it, it does make a huge difference in how long I can last by going into such flexion, which deadlifts is going to make us do. Then, of course, with a burpee, you can break down each movement, and I think you'll really appreciate feeling nice and level from the pelvis up through the shoulders, okay? So what we usually do is we try to get into a position, and I say a relaxing position, where we lay flat down onto the So-Right or the sand ball, and we just try to find a way to release left versus right. So you might see me kind of shimmying my I guess you can't see my lower body here, but I'm just shimmying back and forth to try to find where can I get the most amount of pressure. Now, I'm going to pull my knees in together and turn my toes in, so I'm in internal rotation on both hips there. And then what I'm going to do is reach my arms out and then try to pull my shoulders down into a better set position, and then I'm going to pull my nose away from the floor here while maintaining good breathing. So every so often I'll go completely limp, but when I lift my head up, big breath in, hold, exhale, and let your body kind of shimmy back and forth, and then completely relax, new breath in, lift the head, brace, exhale. I'll give you a side view and then I'll give you a view for my feet. So side view, get it into a good position there, right above the pelvic bone, and then let yourself kind of sink into the same position. Okay, and then if I'm showing you from behind here, my knees squeeze together and then my toes turned in, and then as I breathe in and out, I'm kind of just shimmying back and forth to find where I need more pressure. Okay, so why is this important? If you guys know much about the anatomy, and especially for the patients that I take care of here in Northeast Ohio, I'm always stressing about the pelvis being pulled up into a higher position or a lower position on one side versus the other, which brings you into a short leg, long leg, which a lot of you have come to me and said, hey, I've been told in the past I have a short leg or a long leg. And most of the physicians that maybe have assessed you in the past or trainers, they don't actually mean that you have an anatomically shorter leg, but what I would deem is what's called functionally short. So if the pelvis is out of alignment, it will actually pull the one leg into a shorter position. Therefore, you have a longer position on the other side. So what ends up happening is you might feel like a hip flexor is tight all the time, or a hamstring, or the calf, or the bottom of the foot, or part of your back, or maybe you don't have overhead position on the opposite side as cleanly as the other side. Whatever it may be, if that pelvis isn't quite in the best alignment, you're going to start getting these little tightnesses here and there that maybe we can release from time to time, or we can try to stretch from time to time, or maybe after you've warmed up properly, you feel like they're starting to become more level, but whenever like the dust settles, the workout's over, maybe later you're home recovering, you feel a little bit off. And so that's usually when the chiropractic part, can come in and tune you up, so to speak, put you back to level so you can go out and perform. Well, seeing as this is a mobility video and I can't adjust you through the phone or the camera here, you can do a little bit of like damage control and see before the workout starts which side is talking to me more than the other. Okay, so that's the goal of this, is to kind of go through and check and see what side feels more like it needs attention. Okay, and after you spend between 2 and 5 minutes releasing this, then we're going to get into like more of the warm-up. So I just wanted to go over this first. It's really important when you see a workout that asks and demands so much of the lower back. It is nice to kind of check in and see right in the middle what is going on, okay? Because the hip flexors will tell you a lot, and like I said, if you can get them to cooperate before the workout, I think it will really help you out throughout the workout as it continues on, okay? So let's move on to the next part. All right, guys, so now that we released the hip flexors, it's time to teach some movement to the lower back and pelvis before it gets under load. So what we're gonna do here is we're gonna take a band and wrap it around our lower back, and we're gonna go through pelvic extension and low back extension, and then pelvic tucking into flexion, and low back going into flexion. And we're gonna hold each of those for a 2 Mississippi. Now, for some of you, you might say, hey, well, can I bring the rest of the spine into extension? Absolutely. If you wanna leave the upper spine into extension and just go through your pelvic tucks there, just make sure you hold a 2 Mississippi there in flexion, let it return back into extension. And then you could also take the upper body into flexion and then just play around with lower back extension and then lower back flexion. All three of those are great options. Just make sure you hold for a 2 Mississippi at each end range there, and then we'll move on to the next exercise. All right, guys, I want to show you gorilla lifts from foundation training. There's a lot of good hip openers out there. You guys can search YouTube for your favorite, but this is my favorite, and I think it does a great job before we deadlift, okay? So legs are nice and wide. I'll show you from 2 different positions here. Legs nice and wide. We're going to shift the hips back, and I'll show you from another view. Shift the hips back, okay? And then eventually let your rear end reach behind you, almost to the point where you're gonna fall over, and then the hands can come out in front of you, and we're gonna let the spine hang for a second. This is not the gorilla lift. This is us just kind of hanging out and seeing what each hamstring feels like. Just like we assessed the hip flexor, what do your hamstrings feel like, okay? As the butt's kind of reaching behind you, we're gonna slide the hands under our face or our eyes, and we're gonna drop the hips and shift them slightly up and back as we extend the arms. And what we're going to do here is we're going to supinate and reach the hand out in front of us as we pull the hips up and back. Notice I have a little bend in my knee. Hold that for a 2 or 3 count. Supinate the other arm, reach out in front of me, maintain that as we come back down, and we would repeat that for repetitions or time. Couple key points is I want you to try to think about either spreading the ground apart or squeezing it underneath you, but all while we're trying to pull the hips up and back. My low back is going to be feeling some type of, not want to say tension, but it is being activated. But what we're trying to do is prime the posterior chain to help us while we're hip hinging, hopefully hip hinging properly through the deadlifts. And also some people, when they do burpees, they hip hinge down to the floor, come back up, hip hinge, jump, etc. So this is a really good way to get the hips primed for this movement. There's another thing we can do too, which would be like lateral tilting, if you will. So we'd be in that same really nice wide position, hip hinged back, come back to the floor. Maybe you've gone through some of your gorilla lifts from this position here. But then what we can do is we can actually shift our weight to one side by flexing the opposite leg. So we're shifting, come back down, shifting, come back down, shifting, come back down, shifting, come back down. And for those of you who are familiar with foundation training, they'll turn this into a trace. And then we come back down here. Again, shift, trace with the arms, come back down. And the reason this is so great is because if you go through repetitions of 2 to 3 second holds, maybe even to like a 5 second hold, you'll create some good opening into those hips, which should serve you very well whatever this workout is going to bring, okay? I know it's only 2 movements, as far as the deadlifts and the burpees, but the more you can make these hips open up and work, the less the low back has to work. Let's move on to the next exercise. All right, guys, so we released the hip flexors, we started to move the low back and pelvis, and then we primed the posterior chain with some of the gorilla lifts and lateral slides. Now it's time to actually wake up the hip flexors themselves, isolating them. So I think if we hang would be a great option. So we'll get up to a rig. Hopefully we can get in a position nice and easy here. And what we'll do is one leg at a time, we're gonna come up and hold for a 5 count and then lower it back down. And then we'll switch to the other side, 5 count. That is not a 5 count, but I just wanna make sure you guys know, try to make it challenging and isometric and then control it on the way down. And we're gonna go look for reps of at least 10 per leg until your grip kind of starts to give out. But I might run down through like 2 or 3 rounds of that, because what I want to start to see is if you guys hip hinged early in this video to kind of see like how you felt, before you start to bend over and pick a barbell up. If you run through some of these exercises, you might start to feel like whatever tightness you felt in your specific hip flexor is slowly starting to melt away, therefore giving you a better hip hinge back, therefore putting less pressure on your spine. That's what this whole video is about, is trying to take care of what's going to happen post-workout, and so your spine's not going to be hopefully as compressed or put in vulnerable situations, injury, etc. So give a couple rounds of 10 reps per leg a try, and we'll move on to the next exercise. And finally, does anybody care about their wrists? I know I do. I need these babies to do my day-to-day work. Think about this, your entire body going on these delicate little structures. We've seen it before, handstand push-ups leading to having wrist issues. And honestly, if you guys can just spend a couple of minutes doing some wrist warm-up drills, not necessarily mobility drills, but just to get some blood and range of motion put into your wrist, I think it will serve you well. So follow along to the next exercise. Super duper easy. Grab a dumbbell because you're doing 50 reps of the following. Keep your elbow where it should be. Don't let it pop up. And we're going to go all the way down. Let the fingers begin the movement. And we'll come up with a good squeeze. Let it come down. Fingers first. Finish with the wrist. 2-second contraction. Notice how much wrist extension I'm getting here. This is the wrist that I broke when I was 10. But the more I do these, it just seems like my wrists have way more range of motion to get into that 90 position or more, whatever I need to do the chiropractic work I do, but also to do push-ups, burpees, front rack positions, all that. Okay, pretty simple. We'll go through 50 reps per side, see how it feels. If you guys want to, you can flip back around the other way and do some wrist extension work. You'll probably have to go much lighter than whatever you chose for the wrist flexion work, but try to wake up a lot of the extensors here, the forearm, good grip, come back up, pump some good blood into those forearms, those wrist joints, and let's see how well that serves you when you guys go to brace yourself on the ground for those burpees, okay? Thanks again, guys, for tuning in to this week's mobility workshop for the CrossFit Open Workout 22.2. I hope you enjoyed the mobility prep that I provided for today. I always appreciate feedback, so if you guys can send me some, you know, it really goes a long way to helping me understand what you guys are dealing with and how much this helped you. I think after today's workout, you know, it would be great for you to release your hip flexors once again. 5 to 10 minutes of work can really pay off the next few days of decompressing that lower back. So either with the So-Right or the sandball. And you can also be laying on your back, catching your breath after that workout. Maybe put a box under your legs, hips and knees at 90 degrees. Let the low back decompress. 5-10 minutes can go a long way. But when you get home later, please do your full 20 minutes. I think that's really, really important. And I think it can pay off, especially as you get back into next week's training, etc. So wherever you guys are at in the world, if you're dealing with certain issues of the spine, pelvis, knees, ankles, toes, I know we go over a lot of things on these videos, but reach out to me. I'm in Northeast Ohio. I can't serve all of you because I have no idea where half of you are even from. I know my clients, they're on their own specific program with their mobility work, and we're always communicating back and forth as they're getting better, or if something does pop up and they start to feel tension or pain or what have you. So reach out. Maybe I can point in the right direction. I don't know anyone else who does what I do specifically, but of course, you know, wherever you're at in the corner of the world, maybe I can help you find somebody who might be doing something similar. And at the end of the day, it's all about helping you guys live well and feeling better and moving better too, so you guys can get out there and crush PRs, as silly as saying that might be. But anyways, again, feedback from today, please send it my way. I really appreciate it. I hope you guys had a great workout. And yeah, we'll catch up next week. 22.3 should be releasing on Thursday, and we'll go from there, okay? Other than that, Dr. Jim, signing off. I hope everybody has a great weekend. We'll talk to you soon. Take care, everybody.